Hello, my name is Holly Wise, and I'm a physical therapist who has been working with individuals with a prior diagnosis of polio for the last 30 years. Today I'm going to be talking to you about the importance of posture to the person with a diagnosis of polio. So the first question to answer is, what is posture? What's the definition about posture? Well, posture is very relative. It's the relative arrangement of the body parts, Good posture is the state of muscular and skeletal balance and can protect the body against injury and promote efficient function. So what happens to posture when you have muscle atrophy or weakness from polio? Well, it can cause the rearrangement of these body parts due to this weakness and atrophy and have a musculoskeletal imbalance. Impaired posture, or a relative rearrangement of your body parts, is actually a secondary condition that happens after you've had polio. It's a new condition or problem that can develop during the life course of a person who has a primary condition such as polio. And so it's directly related to the diagnosis of polio, but didn't happen immediately because of the polio. It's probably one of the most common secondary conditions associated with polio, although the top 3 to 4 are the ones that contribute to the diagnosis of post-polio syndrome. And those conditions are the new muscle weakness in muscles previously affected by polio is the most common secondary condition. Sensitivity to temperature is another one, as are fatigue and chronic pain. But if you look down the list, scoliosis, which is impaired posture, is also one of the most common secondary conditions in people with a prior diagnosis of polio. So why is it so important to learn about impaired posture and what you can do to improve your posture? Well, when you have impaired posture secondary to polio, it can lead to a decline in your health, in your ability to function and be independent, as well as in your life satisfaction and overall quality of life. When you have impaired posture, it can lead to a decline in respiratory function. A severe scoliosis can compress the lungs and your ability to breathe fully, and as well as contractures associated with impaired posture can lead to arthritic changes, pain, and depression associated with all this decline in health status. Impaired function may also result when you have contractures because you may need assistance with your ADLs. Your lack of full movement may make it difficult for you to do activities such as reach up overhead, dress independently, etc. You also can have pain and fatigue associated with limited activity tolerance from the scoliosis and the impaired posture. All of this difficulty can contribute to a decline in function and decrease your life satisfaction, as you can well imagine. So it's really important for the comprehensive management of the person with a diagnosis of polio is to make sure that you prevent or try to reduce the impact of these secondary conditions, such as impaired posture. So how do you do this? Well, a lot of this occurs through education of the individual with this diagnosis, but also by having the healthcare team working with the individual to help achieve the best possible postures throughout the day. Postures are not just static posture, it's also when you're bending down, sitting, squatting, walking. So we want to look at posture standing, posture sitting, your body mechanics when you bend over and pick something up, and your posture sleeping or lying down in bed. So how do you help someone improve their posture? Well, it all starts with looking at their different postures and doing an analysis of the positions. What is your impression concerning the cause of the postural imbalance or the relative rearrangement of the body parts? What can be done to help improve the posture or to reduce the impact of impaired posture? After you do that, you come up with an impression or an opinion and make recommendations to manage impaired posture. As a physical therapist, when I do a postural analysis of an individual, I not only look at their static postures, as I mentioned, but also their dynamic movements. And then I make a judgment as to what I think is contributed, what muscle groups are contributing to the impaired posture, what needs to be stretched out, what needs to be strengthened, and in the absence of the ability to be strengthened, perhaps what needs to be braced, etc. But we then look at the pathokinesiology, the abnormal movements, to see if they can be reduced in severity. Part of the reason that pain and fatigue are associated with impaired posture can be explained by looking at the next few slides. Did you know that for every inch of forward head posture, as the head moves forward of the rest of the spine, that it actually increases the weight of the head to help hold it up and the impact on the head, neck, and shoulders? So that if you're out of alignment, you have relative rearrangement and your head is in front of your chest, then you're going to have an increased loading through your neck, which contributes to the pain and the fatigue from holding that posture throughout the day. Likewise, in the low back region or the lumbar region, there are studies that have measured the pressure between the discs at L2, or the second lumbar vertebrae, between the pressure between L2, L3, looking at interdiscal pressure. And they found that if you look at the dark shaded individual standing upright, that's at standing. If we look at that as 100 baseline, that when you lie down, you have decrease in pressure between your discs. But when you lean forward, as in leaning over to pick up something, the interdiscal pressures increase significantly. When you look at sitting upright in a chair, which many of us do all day long, there's an increase in interdiscal pressures than just with standing upright. So sitting is associated with increased discal loading, and sitting when you're leaning forward increases it even further. So that you can see that different postures, both at standing, sitting, lying down, greatly determine the amount of pain, pressure, contractures that you can develop throughout your life course. Well, why is there such an increased load when you're sitting? Well, it has to do with your relative alignment and arrangement of your musculoskeletal system. In the standing position, your lumbar spine, which is shaded in the slide, is in a little bit of curve, and that's called a lordosis. And our body is designed to disperse the pressures evenly when the posture has lordosis. When you sit and your knees and your hips are flexed, it causes a flattening of the lumbar spine, which actually increases those discal pressures. So getting a good sitting alignment is very important to help reduce a lot of the pain and the fatigue associated with impaired postures. This slide, the next slide, just illustrates the difference when you have a forward head, slumped posture, and that you're relatively rearranged out of normal alignment, that you're going to have increased loading on your spine with the accompanying pain, contractures, etc. So a good seating assessment is very important when you're working with someone with a diagnosis of polio and any of these symptoms due to muscle weakness and atrophy and/or contractures. And that includes sitting in a chair, sitting at your desk or at the computer, looking at alignment issues there. Even if the individual's in a wheelchair, looking at their position in a scooter or a wheelchair, they may think they have good sitting alignment, but there are many ways that it can be improved to help even minimize other secondary conditions with polio. Sleeping postures can also be improved. Many times we sleep side-lying, but that can increase the torque or increase the pressure on the low back, whereas a pillow between the legs, and although this picture doesn't show it, using a body pillow and using a pillow all the way down through the ankles can set the spine up in better alignment and actually give you less pain and a better night's sleep. So an individualized physical therapist evaluation will actually look at your posture in a variety of positions, both static and during movement. Measure the alignment of your spine, the rearrangement of your body parts, the length of your legs, the curvature of your spine, and come up with recommendations that can help improve your alignment and improve your posture as much as possible throughout the day. Based on our recommendations, different course of management can occur. If pain is your primary problem and it appears to be related to your posture as well, there are many different interventions that we can use for pain management. Many times you can't accept, an individual may not be ready to accept other suggestions for postural improvement until their pain is managed sufficiently. If the postural alignment is due to weakness in muscles or contractures, and if the muscles can be strengthened, which many times in the case of an individual with polio, they cannot be strengthened if it's 30, 40 years down the line. But if they can, a therapeutic exercise program individualized to that postural analysis can be prescribed. In addition, stretching exercises can be done for the general population and for the individual with polio with relatively few contraindications for stretching. And in most cases, it's imperative that we stretch for our whole life course. Occasionally, assistive devices are recommended that can help with alignment as well. For instance, if you had a leg length difference, you may need, in addition to a shoe lift, or you may need the use of an assistive device to walk more upright and not have such an unbalanced gait when walking. Bracing, trunk support, corsets have occasionally been recommended depending on muscular imbalance as well. And an area that needs greater attention, I believe, is a seating assessment by someone who is specialized in assistive technology. And that's an ATP or assistive technology professional who can individualize your seating to you. And that means that one scooter or one jazzy chair does not fit all. It has to be an individualized, customized wheelchair in some cases if you're sedentary and sitting most of the day. An example of how we can use some assistive devices to help improve posture, decrease pain and fatigue can be illustrated in this slide, where this individual with polio was having significant back pain. She had several herniated discs as well as a history of frequent falling and excessive fatigue. She did work full-time. She worked as administrative assistant in a legal office and walked great distances. However, she had significant muscle weakness and a leg length discrepancy, so that you can see the impairment in her posture was contributing to the shearing of her back, causing the pain, the falls, because she did not have normal balance reactions in her leg, and fatigue. So the use of an assistive device, and she'd only use one cane, she wouldn't use two Lofstrand crutches in this case, helped improve her posture and help minimize the discomfort and fatigue that she felt with long distance walking. Here's another example of how sometimes changing the seating alignment can improve posture and reduce pain. This is another individual with a prior diagnosis of polio approximately 30 to 40 years ago, who originally was ambulatory when I first met her, but due to significance of pain, fatigue, and increased muscle weakness, she progressed to walking with Lofstrand crutches for short distances and first started off using a scooter for the long distances. However, a scooter is not always the best seating alignment because the hand controls are in front. You drive with the hand controls, and that puts you into a forward head posture position. In addition, a scooter does not allow you, in many cases, to recline and elevate your feet. And as her condition progressed and she had progressive weakness, she actually started noticing an increased incidence of neck and upper back pain, as well as persistent swelling in her lower extremities with her decrease in her walking. So we referred her to get a seating assessment with another physical therapist who's a specialist in seating assessment, and a power chair was recommended, because not only did it allow her to recline and elevate her feet throughout the day, but it put her in a better sitting alignment. The hand controls for her wheelchair were right beside her, and it wasn't in a forward head posture. So she's back on the road and has many more miles to go with less pain and less fatigue. So posture is important and it needs to be looked at, but it does take someone who's familiar with abnormal rearrangement of body parts and is also able to make suggestions for improving your alignment or reducing the impact of that alignment on pain, fatigue, and improving your quality of life. So it's important when working with people who've had a prior diagnosis of polio to be cognizant of the secondary conditions that can develop unless you take preventative measures. If they do develop, then how you can jump in and help reduce the impact of it through education, changing behaviors, and lifestyle risk factors, and by being aware of the environment and the use of technology so that you can keep your increased function and increased independence by using technology. So that concludes our talk on posture today, but certainly if you have any questions or you want to individually email me for a further explanation, please do so at wisehh@musc.edu, and I'll be happy to keep in touch with you. Again, thank you for the opportunity, and I look forward to hearing from you.